All right, good afternoon, or almost evening, I guess, South Coast. This is Mike with the Bedford Guide for Our Reporter. We are doing our weekly talk with a local expert doctor to talk COVID. I'm live here with Dr. Sundar to discuss the status of COVID-19 and travel. So how are you doing, Dr. Sundar? Can you just tell us how you're doing and a little intro of who you are and what your role is at South Coast?
Good evening, and thank you so much for having me today. I'm Dr. Shobita Sundar. I'm an internist with Southcoast, and I serve my community in Fall River and the neighboring towns in southeastern Massachusetts and Rhode Island. I feel extremely happy to be on this show and to share information about coronavirus so that we can make informed decisions. For the past year and a half, we have been in a pandemic that changed all our lives, as you know, and we've had great impact both physically, mentally, socially, and we have taken great strides to come this far. Our country has been the first country that's able to open up our borders, and we are able to move around, of course, with precautions. It's only a little bit longer we need to wait, and soon the pandemic will be behind us. This pandemic basically has made us to be more aware of public health and the importance of social well-being and responsibility. So South Coast has taken a lot of effort in doing this and bringing us to this point, especially in southeastern Massachusetts.
Yeah, so could you talk about the origins of the transmission, the variants, the mutations, that kind of thing? Just give people a 101 on it.
Yes, definitely. In fact, it is extremely important to know and have the knowledge about this virus. So, coronavirus is a very important human and animal pathogen. And at the end of 2019, a novel coronavirus was identified as the cause of pneumonia in a cluster of patients in Wuhan, China. The peculiarity of this particular virus was the fact that it spread rapidly in the community and it caused a local stunning problem in Wuhan. Soon it spread into the rest of China, causing an epidemic, and then it overflowed into the other countries in the world, causing the pandemic, and brought the whole world pretty much to a standstill at one point when we look back into March and April of 2020. In February of 2020, WHO recognized this disease, coronavirus, and the fact that it caused acute respiratory distress syndrome in adults. And so they designated it as SARS virus 2. It is definitely a good designation because it caused the respiratory distress syndrome and therefore leading to a lot of death around the world and a lot of illness and morbidities. In the classification of coronavirus, it is actually an RNA virus, and it is similar to the RNA viruses that are seen in bats. So the thought was that it was the vector, it was obtained from this bats that it transmitted to the humans. Exactly how the transmission happened directly from the bats to the humans or whether it was by some other intermediate mechanism is still unknown. The variance with coronavirus is extremely important to understand. Like all other viruses, coronavirus do mutate over time and it evolves. But most of these mutations are not very significant because it does not impact the viral function. But certain mutations are very important because they are rapidly emerging and very transmissible, and it spreads quickly and also causes clinical concern. To name the mutations, we are using the Greek alphabets: alpha, beta, gamma, delta, epsilon. So the alpha mutation was from UK, the beta from South Africa, the gamma from Brazil and Japan, and the delta from India, and the epsilon was isolated in California. In order, the importance of mutations in viruses is that when it mutates, it has extra power, or it gains certain properties that it didn't have, the previous one didn't have. So with regard to coronavirus, it was the fact that this new mutant has extra power to infect quickly, to spread rapidly, cause severe disease. So the main way of stopping these mutations is to use extra precautions to prevent the spread. The precautions are the three main ones: the mask, the washing of the hands, and social distancing, and vaccinations. So, vaccinations do arrest the spread, and therefore the mutations will be stopped. So, that's why we are taking so much effort in trying to hold on to the precautions and also increase vaccinations. Now, the transmission of this virus is actually exponential. So it's from person to person. So one person infects two, and then the two go and infect four. So it's a very important thing to understand that it is very easily transmissible, very quickly transmissible too. And it goes so exponentially that the whole population gets infected in a very short period of time. Now, this virus is detected mainly in the saliva, the secretions from the nose, and also eyes. And so the transmission is mainly through the respiratory tract, that is the mouth, nose, and eyes. It is important to cover the nose and mouth with masks, definitely, to prevent this. But the virus is also detected in other secretions: the blood, the stool, the semen, the ocular secretions. Now, this is a respiratory virus. So, blood-borne transmission in respiratory virus is unusual. In fact, they have analyzed blood transfusions and recipients, and transmission has not been documented in blood transfusion recipients from people with COVID in the past. Now, fecal-oral transmission, because it's found in the stools, and they did detect the virus particles in sewage, and that was a big study that was done in Boston. Fecal-oral transmission also has not really been basically documented. The other form of transmission, other than respiratory, is through contact droplets. That is, droplets that are landing on surfaces. So that is documented, and that it is important to keep the surfaces extremely clean by using products which are approved for this purpose of cleaning for coronavirus. Now, the exact time or interval that a person can transmit the COVID-19 virus to another person is kind of a fuzzy range. We are not exactly sure, but it is documented that the transmission is highest before the people develop, after exposure, but before they develop symptoms, the 2 days before they develop symptoms and a day after they develop symptoms, what we call a pre-symptomatic and a post-symptomatic. Transmission from a person with COVID-19 after about 7 days, quite unlikely. So we do need to be able to quarantine as soon as the contact happens, because we need to be careful not to spread the disease. It's important to know this guide. It's like a little guideline. So 2 days before the exhibition of symptoms by the person and a day after they exhibit symptoms. Now, there's another concept which is called a prolonged viral detection. A person gets COVID-19, and then for several months after that, they can still test positive. So, whether these people are infectious or not, again, is a topic of contention, but we think that this viral RNA that is detected probably is not potent, and maybe it's just the particles, but they are present in the nasal secretions. Now, prolonged viral RNA detection is most common in people who've suffered COVID-19 for a long period of time and severe disease. When they've had severe disease, this prolonged DNA can be detected in their secretions, which mainly is the nasal secretion. So, going back, just to capture this whole thing, the route of transmission is through the mucosa of the mouth and also the nose and the eyes. So covering with a face mask, which will cover both the mouth and the nose, is extremely important. And also in certain settings, to use eye goggles and eye protection. Now, the risk of transmission also depends upon the closeness and the duration of exposure, travel, household contacts, healthcare, and long-term facilities, which we already know from outbreaks that has happened in nursing homes, and of course, indoor settings. So, in closed spaces, the virus can spread easily. Therefore, it is so important to be aware of this risk of transmission and avoid these situations and use precautions. Now, with regard to the environmental contact, for example, droplets on tables and chairs, it is important to disinfect with EPA approved products for cleaning. Now, another question comes up here. What about the risk of reinfection? Suppose the person has had COVID. Is there a risk of the person getting COVID again? So, from all the reading and studies, I have seen that when a person has had COVID, for the next few or several months, the risk of him getting another bout of COVID infection is probably much less. So they say that prior infection reduces the risk of getting a reinfection by about 80 to 85%. And most of these people do have antibodies. But even if you are infected, you do need to get vaccinated. Okay, so because that's another question that comes up. Okay, I was infected. I know I'm going to be safe for the next several months, but the antibody wanes over time. Again, we've only been in this about a year and a half. So vaccination is definitely important in even these patients. So the next thing that brings us to is prevention. What can prevent the spread of the disease? So, the first important thing is universal source control, especially in healthcare situations where we have to wear masks and eye protection, PPE, and also early detection of patients and then isolating them so that they don't spread the infection. And of course, environmental disinfection, which is extremely important. On a personal basis, we all have to be using masks. Of course, we have to have social distancing and social bubbles, which we were following very strictly. And also washing hands with more than 60% alcohol disinfectants. Now, the general measures, again, we have to keep talking about this because it is so important about the measures to prevent disinfection and diligent hand washing, avoiding touching the eyes, nose, and mouth, and cleaning and disinfecting with EPA approved products, and adequate ventilation. For example, indoors, closed spaces are definitely cause increased spread of the disease, and therefore, outdoor setting is definitely an important thing. And when people have gatherings, it's probably a good thing to bring it outside.
Yeah, if I could talk a little bit about the vaccines. I've talked to doctors in the past.
Yeah.
The side effects are fairly rare, and really dependent on each vaccine might have its different side effects. Can you just talk a little bit? It's fairly rare because some people out there don't want to get it; they're afraid of it. But I've tried to alleviate some of the fears that they're pretty rare.
Yes. Yes. So we are very fortunate and blessed in the United States because we have three best vaccines available for use: Pfizer, the Moderna, and the J&J vaccine. So Pfizer vaccine has obtained full authorization. The mechanism is by it is an mRNA-based vaccine, and it is given in two parts. First dose followed by a second dose in about 3 weeks. And now we are talking about a third dose in about 8 months. And of course, we've started giving a third dose for people who are immunocompromised or who have cancer, chemotherapy, or on immunosuppression and immunocompromised diseases. So we are already giving those patients. The efficacy of the Pfizer vaccine is 95% in preventing the disease. Now, when we talk about reactions, we have local reaction and a systemic reaction. The local reaction As with every other vaccine, we can have pain, we can have swelling, we can have redness, and we can have some lymph nodes under the arm where we had the vaccine. Systemic reactions, again, it's a whole slew of symptoms from headaches, nausea, tiredness, fatigue, fevers, chills. So those can be managed by using Tylenol, ibuprofen, and taking rest and adequate hydration. The very rare side effects, which I do need to mention here, is anaphylaxis. And with Pfizer vaccine, the anaphylaxis rate is about 5 per million, and myocarditis. The second vaccine is Moderna vaccine. It has been given the emergency use authorization. It is also an mRNA-based vaccine. It is a two-part vaccine, the first one followed by the second in about 4 weeks. And then now we are talking about the third vaccine, again given to immunocompromised patients already, but in others about 8 months. The efficacy of this vaccine is 94%. This also has the same local reactions in the arm with soreness, redness, rash, pain, swelling, and the systemic reactions with the headache and the fevers and the myalgias and joint pains. And they all can be treated with Tylenol, ibuprofen. The rare side effects, again, being anaphylaxis, which happens about 2.8 per million, and also myocarditis. The third vaccine, which is Jnj Vaccine, it has emergency use authorization. It is a different mechanism. The vaccine acts, it is a adenovirus-based vaccine, and it has efficacy, which is about 65% in preventing moderate to severe disease and 85% in preventing severe disease. Again, the local and the systemic reactions are pretty much the same, with pain and swelling and redness in the arms, and the systemic reactions with the fever and the chills and the body aches. And again, treated simply with fluid hydration, rest, and the Tylenol, ibuprofen. The serious or the rare side effects are the thromboembolic, which is the blood clots and causing decreased platelets, thrombocytopenia, which happens about 6 per million. And the second one is GBS, Guillain-Barré syndrome, which is also very rare, 8 per million. So these are the 3 vaccines that are available to us. They are very precious, and we are so blessed, and they are effective, and we are seeing it already.
Yeah. So the bottom line is they're available, they're effective. They do give you a higher chance from getting the disease, but the real point of vaccines is to prevent you from getting severely ill or death, right? Compared to being unvaccinated.
Correct.
So you just returned from India. So what is it like overseas, globally, compared to the United States?
It is very different. I'm going to India after a year and a half, and I did feel the difference. In the United States, like I said before, we have opened up the country. We are almost back to a new norm, what we can say, although we are using the precautions. But back home, it's a little different. And it's different from state to state because each state has a different rate of coronavirus. So the movement in the street has lessened much because I'm not used to not seeing streets full of people. And now I'm seeing streets and there are people, very few people, less people than what it used to be, less cars on the road. And of course, people are wearing masks. The thing that I noticed was as soon as I land, usually relatives, friends, they all call up. I don't even have to call them. They come home. They come home to visit me. This time it was very different. Nobody came home. So here I am calling people saying, hey, I'm here. And there was not even one person who said, come home and visit me, except an aunt of mine who is 72 years old. And she said, can you come, Shobit, to see me? So I said, are you sure you're inviting me to your house? I just traveled. And she said, yes, I really want to see you. So I went with my mother. I'm sorry about the story, but I felt terrible. I said, well, and she is 12 years younger than my mother. So we both went. And my mom said, I'm not coming upstairs. She's a physician herself. She said, I've been going to the hospital, so I'm going to stay downstairs. So you go upstairs. So I went upstairs. She says, come on in. And I'm seeing her after a year and a half, and she's walking with a cane. She is in a lot of pain. She has pain in her knees, and she has put on a lot of weight. It was very depressing. I saw that. I sat, we spoke for a little bit. And then she gave me some presents. I came home. She came downstairs to meet my mother. And my mom looks at her and felt terrible. She said, I couldn't believe, because for a year and a half, they haven't met either. So she's been basically in the house. She's been going for therapy. She said, the only time I go out is for therapy. She does not cook much. She has a servant who comes 3 times a week. So life has changed in different ways. But it will all get back to normal. People are getting vaccinated there. And so on the promising front, it is going to get normal. But it is.
If you could explain, I always get this on social media, masks don't work, right? So that's what people will say. And I try to explain to people, the N95s are much better than obviously cloths, but the cloth masks aren't, they're there to make sure you're not spreading is further out and you keep the reduction of how much, why don't you explain it? You're the doctor, you explain the effectiveness of masks and why we wear them.
So as we know, coronavirus infection is transmitted by respiratory droplets. So even when I speak, I am actually having droplets drop all over here on the table, on my phone, on the computer. So wearing a mask does reduce the amount of droplets that come out of my mouth and my nose. When people sing, for example, we are actually expelling more droplets into the environment. It is actually a social concern as well, and this is where public health comes in. Definitely, masks do reduce transmission, not only of coronavirus, of anything. When people are sick, we do wear masks so that we don't infect other people. So we are concerned about ourselves so we don't get sick from others. At the same time, we are also concerned about others and public health. So it definitely reduces the number of particles that come out. Of course, like you said, N95 is the best, but all of us can't afford to wear N95. But using the mask definitely helps to decrease the number of particles that come out of our mouth and nose into the environment, and therefore reducing the spread of the virus. And we have seen this because I felt so safe at the airport, in the plane, because everybody is masked. Everybody has had a vaccine because we are supposed to show the card, and everybody's tested. So we were all negative, the cohort of people that were surrounding me. So you feel safe. So there is definitely proof that masks do work, and mask is important, especially under the circumstances. And this is not going to last forever. We are seeing the light at the end of the tunnel.
Yeah, so, I think, and to go over vaccines, Governor Baker brought up a good point. So a lot of times people use the province town as a negative towards the vaccine, but he explained it and other doctors explained it. You had 1,000 people get infected. Most of them were vaccinated, but it's because they had rain on 4th of July. They got pushed inside. People got, infected, even though they were vaccinated, but only 6 of them had to go to the hospital. I think 1 died.
Yes.
So people use that out on the internet to say, look, vaccines don't work. People got it. But it's the misunderstanding of what the purpose of vaccine is, to keep you from the ICU and death with a higher chance of reducing the risk of actually getting COVID.
Correct. Mm-hmm.
Yeah.
And another thing is also it prevents the mutations happening. So it's clear that these vaccinated people got the virus, but it was not potent enough to cause death in these people. So this virus, already we know that this mutation has not been effective enough to make things worse. So vaccination is definitely important, and that's the only way we are going to conquer the virus.
Yeah, and I also had a doctor explain to me, because someone in the comments is saying vaccines don't work, need a booster already. It's different when you have something like polio or something that you get a 1 shot and you pretty much eradicate. You don't need another one. But when you get to flus and COVID, you need to recharge your immune system constantly, I think. And he was explaining that it might be here for years because it's something that you have to get new variants. You have to keep getting booster shots. Mm-hmm. It's not something that your immune system is protected against for the rest of your life, like polio or chickenpox, something like that.
Correct. Actually, we know flu happened 100 years ago, and we have the vaccine, and it's probably about 50% effective. Sometimes it's not even that. And we get vaccinated just so that the symptoms are much lesser and death is the end point. So this is also a respiratory virus, which probably will behave like the flu virus. So getting better vaccines, so that is in the research, and getting a booster does not hurt because we've already had two, and getting a third one doesn't hurt. It only prevents the spread. If you take smallpox, for example, I remember getting smallpox vaccine as a child multiple times in school. And we would all line up and we would get smallpox vaccine. The initial one was given when I was born, before I left the hospital as a baby. And that was given on my thigh. But then in school, every single year, I remember probably up until middle school. And then they stopped vaccinating because it was eradicated, but it took years of vaccination. So whether I had antibodies or not was not the question. The question was, let's get everybody vaccinated again and again and again. And it happened every single summer in our arms. They would put it in our arms. And they would scratch it into our arms and we'll get a little boil there. But everybody got vaccinated over and over and over again. And although that vaccine is actually a lifetime vaccine, I would think, because it was a live vaccine, and still everybody got vaccinated. And thanks that everybody got vaccinated, we have now eradicated smallpox. So this might be the same thing too. It is a respiratory virus. It is behaving like the flu virus. So it is causing these mutations to happen. So we might need to have vaccines changed or improved every single year, but we don't know. It's only a year and a half. We have so much that we have learned in a year and a half, and we have so much more to learn. Flu happened 100 years ago, and we are still learning flu. So definitely vaccination do help prevent disease. At the same time, people who have gotten vaccinated and have had the disease, it's much more milder.
Yeah, and the severe consequences, like you were saying, were like 5 per million or somewhere around there. So I want to take a quick question. Tony says, if I was given one shot but was unable to get the second shot, do I have to redo both?
It depends on the time frame of the shots. Sometimes we do give them another course of it. Some of my patients just went in and got the second dose because we are going to give the third dose anyways. So Tony definitely will need to talk this out to her physician, and will need to get her vaccine.
Yeah, so talk to your doctor. They know you best. So I just want to, so you traveled. So what's the best way folks can get ready for this? Obviously getting your shots is part of it. Bring a couple of masks with you. What are some other suggestions?
In the past, travel was a lot of fun. And for me, going back to India was exciting. But this time around, I had to have preparation. I had to prepare. It's not like packing my bags. It was more about finding out what the policies in India are. So when you travel to another country, please make sure you go in and find out what their conditions are, and whether they need quarantine, whether any other certain provinces in certain places are quarantined, so you don't want to go into those places and get stuck. So those are especially if you're pressed for time, so you need to plan it. The second thing, yes, vaccinations are important because that card is very precious, and it was very, very helpful. So for India particularly, they have a website, so we had to download that onto our phones, and then we had to get a COVID test about 48 hours before travel, because it takes a whole day to land in India. So when they check in India, and if it's more than 3 days, then it's a confusion. So I had to get it 2 days before I left. And then because they're checking it at every place of re-entry. So you do need to get the COVID test. You have to upload it onto this website. And then at the airports, of course, we are using masks. And of course, we have to have some hand sanitizers with us, and maybe wipes, which is good to have. But in the aircraft, they are giving wipes. So they give plenty of wipes so we can, make it sterile as much as possible around us, the surroundings. And to tell you the truth, the planes were not full at all. It was probably about half full, which was kind of depressing to me because I've always had planes that were fully booked and packed. So definitely we do need to take a lot of precautions while traveling. And when you land there in India, they do a COVID test when we land and before they send us out, and they get back to us within 24 hours with the results. And if it's positive, of course, we have to quarantine in India. But they do allow house quarantine nowadays. Before, it used to be institution. So a lot of planning needs to be done. Take a lot of masks with you, hand sanitizers, and of course, even in the plane, we are sitting far away because the plane was not really full.
All right. So final question. If people out there want to get vaccinated, where do they go?
This is a very exciting question because I was involved in the Southcoast vaccine clinics that they had across the southeastern Massachusetts. So Southcoast does have the vaccine clinic open up again, and it's every Thursday and Saturday at the Vanity Fair outlet. It is from 4 to 8 on Thursday, and on Saturday it is from 10 to 2. And in my office, we are giving the vaccine. It's every Tuesday from 9 to 3. We are having the vaccination given here. Of course, we have vaccines given through CVS and Rite Aid and the other pharmacies. But I am really excited about the fact that we are starting with our third vaccine. And it's relatively easy because you can show up and you can get your vaccine. You can go online and you can book an appointment and you can just show up at that particular time. So it is definitely a very good thing that Southcoast has started. In fact, I have to actually tell you something about the differences from India to here, because in India, to get a vaccine, it has now become easy. Before, it used to be hard. You go to the site, and then they were going to open a vial of the AstraZeneca. And so the nurse looks around and she counts the number of people. And she said, I only have 8. I have to wait for 2 more because the vial has 10. So she said, oh, they'll come. And then in about half hour, we had 2 more people, and she gave the 10 doses. So I was telling her, I said, where I work in Southcoast, they are above and beyond. I said, even if one person comes, they will open a vial and we will vaccinate that person. And we will have 6 doses, total 6 doses. So 5 doses of the Pfizer. And you know what we do? Because the site directors and anybody and everybody who are working the clinic, they will go online on Facebook and say how many doses are available so that people can come. And to tell you, we would easily finish that 1 vial, and we'll have to open another vial to vaccinate people. So we've been very, very pro-vaccinating and pro-helpful to people, because when somebody shows up, we don't want to turn them away.
Yeah, we do like to do these live streams with Southcoast each week so people can get the information from the experts. But we always tell people your doctor knows you best. You don't have to trust us. Call your doctor, verify the information. If you think you need a second dose or you missed a dose, those kind of things, ask the question, and you can always talk to the pharmacy or just go to Southcoast website and get information there. So we really appreciate your time. We know it's valuable time, and we really appreciate it.
Thank you so much for having me on the show. And if we can do anything more, please let us know. We are always available for you and for my community here in southeastern Massachusetts.
Okay, thank you. Thanks for everyone tuning in. Share this video. Let your friends and family know the most accurate information. Thank you.
So much.